So how do we make this happen? How do we make this accessible for people who may not have the means, or that they say that's just too much. There's no possible way for me to be able to even get to these appointments. And how do we make that tangible for them?
I mean, you show me your budget and you show me your priorities. And I think the City of Columbus has been intentional in, first of all, recognizing that there is a disparity to access to resources, whether that be the actual care that could come from midwifery or from doula care, or just being able to have transportation. One thing I'll even toss out there too is the connection between infant and maternal health and access to housing, safe and affordable housing, and how there is absolutely a connection to whether or not that baby will survive and that mother will deliver if she has a safe roof over her head. But despite that, and we at Council have been intentional about supporting doula work for the last 3 years now. Obviously, we have a line item that supports Celebrate One and all of the resources that it does to support the women in the City of Columbus. And so it has to start there. I mean, the reality is that it does take dollars to raise awareness and connect people to whatever resources that they need to support a healthy pregnancy.
And I'll say too that I think it's going to take all of us, right? I think the city is stepping up in a major way, but the issues that we're talking about with maternal health and infant mortality, these are national and state issues. And so we need our national legislators to be looking at this. We need our state legislators and state governments also, because they hold a much larger stick, right, with hospital systems than we do. But we're going to do our part here on the ground, on the local level, being led by this amazing team to the right of me. But it's going to take state, federal, community, grassroots, everyone stacking hands and saying, how do we address this and how do we remove the barriers, whatever they may be, to make sure we have healthy outcomes? And
I want to just hit on that a little bit more, because Congresswoman out of the state of Illinois, as well as VP Harris, have as of lately talked about the reality of fibroids, and particularly how they have impacted Black women. And if we're having a conversation about maternal health, one thing that does get left to the side is women who have, for various reasons, suffered through infertility, right? And how that plays right into the hands of maternal health care. And so without that, the reality of having a national conversation where there are studies being done that can start to pick apart why these issues do trend heavily for Black women and folks of color, we're really not getting to the heart of some of these issues. So absolutely medical racism exists, but there also has to be more dollars and research done into truly picking apart what is happening with maternal health care just in general in this country.
Even prenatal.
Correct.
Even prenatal.
Yeah.
And I will say, both Director Tong and I have the opportunity to work with our 4 hospital systems here. And I will say the leadership and probably many of the staff at those facilities are aware of these challenges and the data, and they want to do better. And they are putting things in place to provide education, to provide resources for their staff as well as their patients. But these things don't change overnight. It takes time, and it takes years and years of putting work and effort into it. When Celebrate One started over 10 years ago, I think we were really good here in Central Ohio about having one entry point, one open door, for pregnant women to go through and to get an appointment and to get all the services, home visiting. And as we've gotten better with that, and as the pandemic happened, I think we've seen a shift in how we utilize some of those resources. And we're realizing that by not having this centralized intake process, we might be missing some women, and so we've got to go back to basics. And Director Tong and I have been talking to our 4 hospital systems about how we see an improvement, and so that we can get back to that. But it still doesn't necessarily, that one door invitation or phone number doesn't address this medical racism that Councilmember Favor has mentioned and others have mentioned. And I see it not only in maternal health, I see it in other issues. And so I think we have to do better at deciding who gets into medical school. We need more people of color going into medical school. And I'm really proud. I'm going to give a shout out to my friend Dr. Laura S.B. Bell, who has her Made for Medicine program. They're really trying to get more minorities into medical school. But then once we get those kids to medical school, we've got to educate everyone about how to treat people as a whole and not based on the color of their skin.